Phlebotomy Exam Practice Test 2025. Question 1. In order to protect themselves on the job, phlebotomists should have which character trait? Propensity for cleanliness. Fear of infectious diseases. Expressing themselves loudly. Being suspicious of peers. Phlebotomists handle blood and body fluids which can carry infectious diseases. Maintaining cleanliness and hygiene is crucial to prevent cross-contamination and protect both the phlebotomist and patient. Question 2. Clinical laboratory standards of practice in the United States have been established by which of the following organizations? FDA, CLSI, NRA, CMS. CLSI, Clinical and Laboratory Standards Institute, is a globally recognized organization that sets standards for laboratory testing procedures, including phlebotomy, ensuring consistency, safety, and accuracy. Question 3. Which of the following tools is most useful for demonstrating steps in laboratory procedures? Fishbone diagram, brainstorming, flowchart, Six Sigma. A flowchart is a visual tool that outlines a step-by-step process, showing sequences of actions and decision points, making it ideal for demonstrating complex laboratory procedures like blood draws. Question 4. An example of an unfavorable patient outcome during or after a phlebotomy procedure would be if the patient states that he is fearful of the procedure, faints after the venipuncture, has a loud radio going in the room, has several family members in the room. Fainting, syncope, is a known potential complication of phlebotomy and represents an unfavorable outcome because it can lead to injury or further medical complications. Question 5. Which of the following individuals is most likely to perform phlebotomy procedures? Office manager, pathologist, pharmacist, medical assistant. Medical assistants often perform routine phlebotomy procedures in clinics and hospitals as part of their role, while pathologists oversee lab testing and pharmacists focus on medications. Question 6. An example of how clinical laboratory test results are used is body mass index, cataract screening, monitoring cholesterol levels, measuring heart rate. Clinical laboratory test results are used to monitor health conditions such as cholesterol levels, which are critical in assessing cardiovascular risk. BMI and heart rate are clinical measurements done without laboratory equipment. Question 7. Specimen collection procedures are part of which phase of a laboratory workflow cycle? Pre-examination, examination, post-examination, follow-up. Specimen collection is part of the pre-examination phase where the specimen is gathered, labeled, and prepared for testing. Proper handling during pre-examination is crucial for accurate test results. Question 8. Which of the following is a characteristic of a pathologist's responsibilities? Daily rounds with patients, treatment of respiratory conditions, oversight of a clinical laboratory, performance of point-of-care procedures. Pathologists are responsible for the oversight of clinical laboratories, ensuring accurate testing, quality control, and the interpretation of results. They do not typically perform daily rounds or point-of-care procedures. Question 9. Which of the following is the main area of responsibility for every phlebotomist? Analytic testing, data collection, reporting results, pre-analytic processes. Phlebotomists are primarily responsible for pre-analytic processes, which include drawing blood, collecting specimens, labeling them correctly, and ensuring proper storage or transport for testing. Question 10. Part of being a responsible member of a healthcare team involves being confident at all times, understanding the mission, goals, and objectives, always avoiding conflict, sticking to a decision regardless of advice. Being a responsible team member means understanding the mission and goals of the healthcare organization, ensuring your actions align with overall objectives while remaining flexible and cooperative. Question 11. What feelings does one experience when a stranger gets too close for comfort? Anxiety, joy, confidence, security. When a stranger invades personal space, it often triggers discomfort or anxiety. This response is a natural reaction to perceived invasion of personal boundaries. Question 12. The definition of culture includes which one of the following aspects? Anatomy and physiology, hair and eye color, traditions and values, combined family salary. Culture refers to shared customs, traditions, beliefs, and values that characterize a group of people. It encompasses social practices and religious beliefs, but not biological traits. Question 13. EMR stands for which term? Effectiveness of medical reagents, electronic medical record, efficient monitoring of results, electronic medical research. EMR stands for Electronic Medical Record, a digital version of a patient's medical history used by healthcare providers for better record-keeping and tracking patient information. Question 14. Which of the following data should be considered confidential? Laboratory test results, patient's bill of rights, nonprofit status of the health facility, universal precautions. Laboratory test results are part of a patient's protected health information, PHI, which must be kept confidential according to HIPAA regulations. Question 15. What method for requesting a laboratory test is the most error-free? Handwritten requisition, electronic method, verbal method, verbal stat method. The electronic method is most error-free for requesting laboratory tests because it reduces misinterpretation and errors that can occur with handwritten or verbal requests, often including built-in checks. Question 16. Which is an example of a barrier to communication with a patient? Sender, decoder, television, supervisor. A television can act as a barrier to communication because it creates noise and distractions, preventing effective dialogue between the healthcare provider and the patient. Question 17. DOB stands for Don't offer beverages, date of breakfast, date of birth, Department of Blood Work. DOB is a common abbreviation in medical records referring to a patient's date of birth, which is important for verifying identity and patient information. Question 18. Which of the following statements is appropriate during a phlebotomy procedure? This won't hurt a bit. Your name is Mrs. O'Brien, isn't it? You are required to cooperate with this. Could you please spell your last name for me? Asking a patient to confirm their information by spelling their last name is an appropriate way to verify identity before a procedure, unlike misleading statements or demands for cooperation. Question 19. Which of the following is a key element in effective communication? Active listening. Critical values. Color distinctions. Point of care procedures. Active listening is a crucial component of effective communication, involving full concentration on the speaker, understanding their message, and responding thoughtfully to avoid misunderstandings. Question 20. Slouching posture and nonverbal behavior conveys what message? Confidence. Pride. Laziness. Attention to detail. Slouching is a form of nonverbal communication that often conveys disinterest, laziness, or lack of engagement. Body language significantly affects how others perceive us in professional settings. Question 21. If patient results are entered into a handheld device, who would be able to legally access that medical information? Any hospital staff member. Only authorized healthcare professionals involved in patient care. The patient's family members. Anyone with access to the hospital's network. HIPAA ensures that only authorized personnel involved in the patient's direct care can access personal medical records, protecting patient privacy and confidentiality. Question 22. Is it okay for the phlebotomist to collect a blood specimen while the nurse is conducting a health assessment? Yes, as it saves time. No, because it might confuse the patient. Yes, because both tasks are necessary. No, because it interrupts the nurse's assessment and patient privacy. Proper communication and focus are necessary during patient assessment. Collecting a specimen simultaneously may disrupt the nurse's assessment and make the patient feel overwhelmed or uncomfortable. Question 23. Does the patient have to sign a consent form with regard to her electronic medical record? Yes, for any medical procedure. No, consent is implied by seeking treatment. Yes, because use of electronic records must be approved. No, unless a third party is involved. Typically, by receiving care, patients give implied consent for the use of electronic medical records as part of their overall treatment, unless additional or third-party access is requested. Question 24. Is this situation acceptable? Phlebotomist drawing blood while nurse discusses abnormal X-ray results. Yes, completely acceptable. No, phlebotomist should leave and return after the X-ray discussion. Yes, both can perform tasks at the same time. No, phlebotomist should wait until the nurse completes the health assessment. Patient care should be structured to prevent confusion and interruptions. The phlebotomist should wait until the nurse finishes the assessment before proceeding with specimen collection to maintain a calm, focused environment. Question 25. Which of the following is a key element in protecting patient confidentiality? Sharing results with family members. Discussing cases in public areas. Limiting access to authorized personnel only. Posting results on bulletin boards. Limiting access to patient information to only authorized healthcare personnel involved in care is a fundamental requirement of HIPAA and essential for protecting patient confidentiality.